So, David, thanks so much for letting me ask you a couple questions in preparation for this symposium in Santa Fe. I wanted to start just by asking you to talk a little bit, if you can, about your clinical background and your training.
Sure. Thanks for doing this. Thanks for inviting me. I think it's a really exciting opportunity. My joke is with the last name Lay, I really only had two options. I could be a sex doctor or a politician involved in a sex scandal. I really looked closely at that one. Ultimately, decided, though, Anthony Weiner holds the title for most appropriately named sex scandal politician. I couldn't take that on, and so I went with the sex doctor route. I actually started in the field as a psychologist, very traditionally trained psychologist, who got absolutely no training in sexuality during grad school, which is common. 95% of therapists have no training in sexuality. And I was one of them. But then I ended up working with sex offenders, which, I kind of needed some training on sexuality in there. And I did that work for a good many years. And slowly I started finding that lots of my colleagues were referring patients to me for sexuality that was slightly outside the norm, whatever it is we think the norm is, and I don't think we actually know. But it wasn't sexual behavior that was offending or abusive or criminal or anything else. And I realized that there was this huge gap in myself and in the field in terms of addressing sexuality that is, basically outside heterosexual normative monogamy. And I started down this kind of path. I've written 3 books now around sexuality, and I get to now travel the country and train therapists around addressing sexuality in the course of therapy, because I think it's really, really important. Society is changing dramatically. We're becoming much more accepting around sexual diversity. People are watching a lot more porn and aren't ashamed of it anymore. And therapists are left in the dust on this. And I think it's a place where we desperately need to catch up.
Yeah. Well, I'm curious, specifically, how did you become interested in pornography and porn research? How did that happen?
This is just between us, right? I mean, my complete goal was to be able to write off my pornography on my IRS taxes at the end of the year. You're not going to tell anybody that. No IRS folks will watch this video. I fell into it because across the board, whether it was in my own clinical practice or trainings that I was doing of therapists, I was seeing men across the country who are being pathologized, diagnosed, shamed for use of pornography. And it ranged from, men who would watch pornography once a month and were told that they were addicted to pornography, or men who were watching, pornography kind of all day long and losing their job because of it. It's a huge kind of spectrum. And what I saw as I really dove into it was that the real issues weren't getting addressed. And there was a tremendous amount of instinctive kind of bias and oftentimes morally driven response in people in response to the pornography. And then when I started looking at the research, I really found that, wow, there's just so much that has never been examined or addressed. Like, for instance, there is absolutely no research that has ever looked at the question of, does the brain look the same when we masturbate, looking at video pornography, versus fantasizing in our own head versus reading literate pornography? It is likely, given what we know about the brain, that it is going to look differently in each of those 3 cases, but nobody has ever examined this. And so when we talk about pornography, what we're really talking about is masturbation. And that's where then I started realizing that many of the modern anti-porn arguments are really 18th century, 19th century anti-masturbation arguments rebadged. That was where I started really getting concerned that our field, mental health field, and sexuality field, was being used to morally restrict and constrict sexuality and sexual expression um, under the guise of, kind of attacking porn as a mental health kind of problem. And now, we've got state after state that are proposing pornography as a public health crisis. And in each of these cases, it is conservative, typically religious politicians that are introducing that legislation. And this has become a politicized, morally driven kind of debate with pornography kind of at the center. But pornography is just a canary in the coal mine, because really pornography is about sexual self-determination. And that's something that I want to pay attention to, because if society or a government wants to make the decision that we're not going to let you have the kind of sex you want to have, well, I guess that's kind of up to that society and government. It's not one I want to be part of, but it's up to them. But God damn it, mental health and healthcare and my profession should not be used to enforce what you do with your own damn body in a consensual, healthy way. And that's the thing that, I'm a little passionate about right now.
Well, the answer may be, the answer to this next question that you may have already spoken to, but you published a book in 2016 called Ethical Porn for Dicks. It's a funny, really accessible, I think really helpful guide. And I guess I'm curious what you hoped your audience your readers would gain from access to that particular book. What were you after in publishing it?
I realized that there were a lot of guys out there named Richard who watch pornography and need help, and they had no resources, right? I realized that what is written about pornography is written in basically two ways. It is written in terms of saying pornography is bad, it's awful, it's demonic, it will destroy your life and destroy your marriage. Or it is written in a way of saying, pornography is the greatest thing since sliced bread, and everybody wants to be a porn star, and you can have the hottest sex in the world by watching porn. And most of us are actually kind of in between those two things. And I realized that there was nothing written out there for guys who were nervous about their porn use, who were worried, am I watching too much porn? What is too much porn? Is my porn use going to affect my sexuality? Is it going to affect my marriage? How do I make it so that it doesn't? But I don't want to give up porn because there are things that I get out of porn. And it was this all or none kind of argument. And so I wanted to write a book that explored the middle ground and said, my job is not to tell you what to do. My job is not to tell you porn is good or bad. My job is to educate you so you can make the decision for yourself, because that's how good therapy is supposed to work. And that was my goal in writing the book. I mean, what I really loved, I wrote the book for guys. I wrote it in sections that are short enough for them to read on the toilet, because that's the only places guys read, apparently. I illustrated it with petroporn, these dirty petroglyphs that are thousands of years old, because guys need a picture book, apparently. And I wrote it as though I was having a beer with a guy, rather than being a therapist or a scientist. And actually, that book came out of a really awful experience I had on the Katie Couric show, where Katie Couric brought me on to talk about pornography research, and then just really attacked me as I talked about what the research said in contrast to her morally driven fears. But I realized after that experience that I wasn't doing a good job of talking at a normal level, as opposed to talking about research and talking about psychology. I wasn't talking in a way that connect with real people. And so I wrote this book actually in an effort to do that. I offered to send Katie a copy of the book. She declined. I did dedicate it to her. The neat thing about the book, actually, even though I wrote it for guys, is that I've had women really around the world write me and say, I got this book from my husband, but then I ended up reading it and I learned a lot about male sexuality that I never understood
Mm-hmm.
before. And boy, that just gave me an academic intellectual boner.
Yeah, yeah. Well, David, I mean, speaking of, I guess, good conversations, sort of accessible information, you know, maybe I shouldn't be, but I am continually surprised by how difficult it is to have a conversation about pornography, to have a conversation that isn't foreclosed by fear, to be sort of curious about multiple perspectives on pornography. And I guess I wonder, from your perspective, why is that? Why do we have such difficulty talking about porn in a meaningful way?
It's a good, really hard question, and I think we could almost have a good whole symposium about that. I mean, I think that my argument is at its root, when we talk about pornography, we're actually talking about masturbation, and that we have a millennia long history of viewing masturbation as selfish, as too physical, when we want to be a spiritual being, the whole mind body split, that things that are in our mind and in our spirit are healthier and safer and better than things that are in our body. And nothing is more inherently bodied than masturbation. Pornography is non-procreative, and it also changes the economy of sex. When you have to when you have to get married, when you have to support your spouse and your children, when you have to invest an awful lot of resources in order to have sex, sex becomes very expensive. But when you can just masturbate to pornography online, it's very, very cheap. And so now you don't have to invest those resources. And somebody, whether it's a pastor or a girlfriend or boyfriend, who want you to invest a lot in order to get to have sex with them, they now lose some control of that economic argument and that economic market. And that's one of the things that I think we're not talking about, that sexuality now, and through pornography, we have much more individual control over that sexuality than we've ever had before, because now we can reach out and we can find material that is stimulating to us, regardless of what other people told us we were allowed to be turned on by. It takes away that external control of our personal sexuality. And that really frightens a lot of people. Now, I will say, though, that this is a generational issue, that the generations that are freaking out about pornography, that are horribly upset about it and are panicked about it, they are the boomers. They are the older generation. Millennials seem to be much less concerned about pornography. Gen X and Gen Y don't seem to view pornography as a significant issue at all. Younger folks today view not recycling as more sinful than watching pornography. And I think that's amazing, because those kids are going to save the planet. And then they'll deal with whatever pornography means or does. So the big furor right now that is happening around pornography, all the vitriol, all the pain, all the threats, I think that's temporary, and I think it's going to go away as society accommodates and adapts to this new technology and this changing sexuality marketplace.
Wow. What an incredible answer. David, I guess in closing, I'm just curious what you're working on now. What's of interest to you now?
What I'm really more passionate about right now is training other therapists to be able to do this, and trying to figure out the best way to do that. I travel the country doing trainings for therapists. I'm I'm a board certified sex therapist and supervisor of sex therapy so that I can train other therapists on how to address these issues in an effective, patient centered, non shaming way. And that's where I want things to go because I'm not really interested in the David Lay show. I mean, what I'm interested in is people getting help in effective therapeutic supportive ways. And that doesn't have to be by me. I want it to be done by you. I want it to be done by the people that come to the symposium. I want them to be able to leave and take this thought and this approach into their practice because every therapist out there has patients that are watching porn and the therapists aren't talking to the patients and the patients aren't talking to the therapist because they're scared the therapist is going to shame them or judge them.
Yeah.
That's something that I want to change.
David, thank you so much for your time. I'm looking so forward to seeing you in September.
Awesome. Me too. I think it's going to be a really exciting, fun conference.